Hello all, this is Dr. Sue from Purely Pediatrics. I just wanted to provide some information that may help some parents that have been dealing with persistent and lengthy fevers and signs of illness in children. We are seeing a significant uptick in COVID positive people, adults and children, as well as influenza. This is a very, very tough thing for families and children to be dealing with. Is it possible to have both? It sure is. COVID, this new variant, is creating high fevers, which flu generally does as well, and persistent symptoms that are lasting, 7 to 10 days in some kids. We're seeing fevers lasting 7 days. The symptoms that we're seeing with this also is vomiting, diarrhea, cough, runny nose. We're even seeing conjunctivitis, which is pink eye. We're seeing a multitude of symptoms in children. There are some viruses out there still that are not COVID and are not influenza. So if we are testing negative for those, then we know they're likely what's called an enterovirus or rhinovirus, another virus that's out there. It is important to test for COVID still. And what I do recommend is that if you are unable to test at a facility that might be a little more easier for you with a PCR, or if that's something that you need for school or work, always know that the pediatric urgent care can test adults as well. And you can call them to talk a little bit more about that and look on their website. But to do a rapid test is okay as well. And what I recommend is that you do a rapid test when your symptoms are on day 2 or 3. It might be too early if you do it on day 1, and it might be too late if you do it past day 3. So they are still selling those rapid tests in these stores, and they are much more affordable than they were previously. But remember, COVID, we don't know that we have it unless we test. And it's important for us to keep everybody else safe, because it is still affecting those badly that have asthma, that are younger, that are elderly. We want to keep everybody safe. I know that we're tired of talking about COVID, but it is still very much with us. So please remember that testing is always, always recommended. I will never discourage somebody from testing, especially for COVID. Influenza, we can test for that too. It's not always as critical. It's good to know if somebody has the flu. But what I want to do is tell you that if you are sick and you have fevers and you test negative for COVID and you feel like you're okay enough to not have to go to the urgent care or the ER or your doctor's office specifically for a test, make sure that you are hydrating, managing your fevers, getting rest, and please, please try to stay home until you are fever-free for 48 hours without medications and symptoms are generally resolved. They don't have to be fully resolved, but enough so you are able to manage them well and feel comfortable enough to get back to school or work. So, in terms of just being smart about illness, knowing that we don't want to get other people sick, and when we do have fevers and significant symptoms, we are contagious at that point. So I wanted to just send a reminder for that. Again, reach out to your doctors if you are feeling that you are not improving after 4 or 5, 6 days of being sick. If you are worried that you're not drinking well or your little one is not drinking well, that's one thing I want you to make sure you work on, and making sure that we keep those fevers down is going to help us all feel better enough to drink. The drinks that I absolutely love are anything that's got electrolytes. You've got Pedialyte. You've got even Body Armor is great. Gatorade is a great thing as well. Anything that's got some sodium, potassium, sugar. You don't want to drink just water, though, if you're not eating, because water does not have anything in it other than water. It doesn't have sodium, potassium. It doesn't have sugar. And when your blood sugar drops, you feel pretty sick, and that's when you sleep more, and things aren't going to head in the right direction for you because you are going to be dehydrated at that point. So anyway, I just wanted to throw a couple of those things out to you today. Know that your doctors are here for you. Reach out as often as you need to your docs. Know that we understand how frustrating and how scary these viruses can be. Other than that, listen, I hope everybody has a great day. Please stay safe. Do what you feel is best for your family. Know that we are, as physicians, we are here for you if needed. And please take good care. Have a great day, everybody.